Welcome to the Fatty Acid Forum, sponsored by Virtus Nutrition. Join Dr. Sara Kvidera, technical consultant for Elanco Animal Health, as she takes a look at the influence of immune activation on transition cow health and performance. Here's Dr. Kvidera.
Hi, my name is Sara Kvidera. I want to share with you some of the research that I did in graduate school at Iowa State when I was studying with Lance Baumgard, and we were looking at influence of immune activation on energetics in a couple different animal species, lactating cows, growing calves, and also pigs, but also just really trying to dig into the energetics of the immune response and what kind of drain that is on productivity and energy for an animal. And what really set this research off in motion was looking at the differences in dry matter intake and milk yield between cows that were heat stressed and then pair fed to match the heat stress intakes. So what Lance did here was he took a group of lactating cows and heat stressed them. And you can see on the graph on the left, heat stress is going to reduce their feed intake by about 30%. And what he did was took his thermoneutral animals and only let them eat as much as the heat stressed animals were eating. That's otherwise called pair feeding. So we are setting intakes the same. There's no differences in intakes between these heat-stressed and pair-fed animals. Which is interesting when you look on the graph on the right. Despite the fact that they were eating the same amount of feed, the heat-stressed animals decreased milk yield by about 45%, but the pair-fed animals only decreased milk yield by about 19%. So traditionally, it was thought that the reductions in productivity due to heat stress were because of reduced dry matter intake, but there's clearly something else going on here because these two animals were eating the same and producing vastly different quantities of milk. When we dig into it, really heat-stressed cows are secreting 400 grams less lactose per day compared to those pair-fed controls. So feed intake is only accounting for half of the reductions in milk. And interestingly, there's some pretty cool effects on metabolism as well. So with the heat-stressed cows, they don't mobilize adipose tissue. That's shown here on the graph on the left, looking at NEFAs in the heat-stressed animals stay pretty flat. But those pair-fed animals, when they're limited in their intake, they're able to adjust metabolism and really mobilize body tissue, body fat, to provide energy to keep them lactating. So they can spare energy and utilize body tissue for themselves so that they can keep milk production going. And to kind of pair with this, looking at insulin, the heat stress animals showed an increase in insulin over time, and the pair-fed animals show a decrease in insulin. So this increase with the heat stress animals is really energetically puzzling because you think of insulin as a hormone that's released when you're eating lots of dry matter. It's a response to intake. So the fact that it's going up when intake is going down is really energetically paradoxical. And heat stress isn't the only situation where we see insulin go up despite decreased intake. So this is that same graph that I just showed during heat stress, but we also see insulin is maintained or even increases when we intentionally cause leaky gut. So this was a study that we did early on in my grad school career where we administered a compound that we know causes leaky gut. And those animals that got that leaky gut causing compound maintained or even increased insulin levels despite decreased dry matter intake. And then this graph here on the right is another situation of feed restriction. So in this study, the AL cows are the ad libitum cows. 80, 60, 40, and 20 are the different levels of feed restriction. So these cows were getting 80% of their ad libitum intake, 60, 40, and 20. And you can see when we start feed restricting, the insulin goes down. But when we get into a really severe feed restriction, insulin goes back up. And so this is really energetically puzzling because their intakes are so low. Why are they not statistically different than an ad libitum cow in terms of their insulin being released per unit of dry matter intake? We also see insulin go up when we give LPS. So LPS is lipopolysaccharide. It's a component of gram-negative bacterial wall. We use it to study inflammation quite frequently. And when we give LPS, we also see increased insulin. So this really made us ask the question, why is the most anabolic hormone being secreted or in the blood? Why is it in the blood during a hypercatabolic condition? Is it due to direct or indirect effects of whatever situation is occurring? And is it due to potentially compromised gastrointestinal tract barrier function, like we saw in this study, where we caused leaky gut and saw an increase in insulin relative to the pair-fed animals? Like I said, LPS also stimulates insulin secretion, and what we see when this happens is that adipose and muscle decrease insulin sensitivity, but immune cells will actually increase insulin sensitivity when they are activated. Insulin also prevents adipose tissue mobilization, and this doesn't allow for the cow to spare glucose and spare nutrients for herself and use adipose tissue for herself, but it partitions nutrients away from muscle and away from lactation. And then during this situation, immune cells will actually increase their glucose consumption. So they move from their metabolism from oxidative phosphorylation to aerobic glycolysis and become obligate glucose utilizers. They have this huge appetite for glucose. And this helps explain some of the decrease in productivity that we see with an immune activated animal. This switch in metabolism is really fascinating. And one of the scientists that first discovered this, his name is Otto Warburg. He first recognized this in a cancer cell back in the 20s. He saw that cancer cells had a really big appetite for glucose and that they would switch their metabolism when they were activated. So he continued to do research on this and started to notice that not only cancer cells show this metabolism, but also activated immune cells or lymphocytes become highly glycolytic. They have a huge appetite for glucose. And so he was really a pioneer in this research and a little bit of my scientific hero. He was also a mentor for a guy named Hans Krebs. If you've ever heard of the Krebs cycle, he was the mentor for the guy that discovered that whole system. He was family friends with Albert Einstein, and he was also a half Jewish German during World War II, which was a really, really tough time to do research. But Hitler was really so scared of cancer that he allowed Warburg to continue researching, but he was not allowed to teach. He was offered passage to the US, he turned it down. He moved his lab to the outskirts of Berlin to avoid air attacks. So not only was he brilliant, but he really did all of this through some pretty adversity determining times. And he's just a really interesting person. There's a couple really good books written on him. If you ever have interest, reach out. I'd be happy to recommend them to you. So Warburg saw that this appetite for glucose really, really increases when immune cells are activated. Why? What is it about the activation of the immune system that would cause this switch? Well, there's a couple advantages to an immune cell if they are able to utilize glucose. First of all, they can produce rapid ATP very rapidly. So going through oxidative phosphorylation, electron transport chain, that takes time. Whereas glycolysis is quick and you can turn over ATP pretty fast. Another advantage, and I think this is the biggest one in terms of the Warburg effect in immune activation, is the synthesis of biomolecules. So it's a little bit complex, but as you shift that pathway toward aerobic glycolysis, you're able to generate more reducing equivalents and nucleotides and things that are needed as building blocks for cell proliferation. So by shifting that pathway, you're kind of giving that cell the building blocks to continue to proliferate. Another advantage would be the adaptation to a hypoxic environment. So if we think about a wound or something where the immune system is involved, oftentimes it's in an environment that's not oxygen rich. It's a challenging environment. If you think about cancer cells, they're generally, oxygen depraved environments as well. So by becoming aerobic glycolysis utilizers, they can work in challenging oxygen depleted situations. And then another advantage of the Warburg effect is just inflammatory signaling. So as they switch that metabolism to aerobic glycolysis, there are some little metabolites that'll come off and really help promote the inflammatory signaling pathway. So we see this in both innate and adaptive immune cells. And I put together this table for my dissertation looking at all of the literature that I could find on leukocytes, both in vitro, ex vivo, and in vivo when they were studying them in actual tissues. So just starting up here, there's a bunch of different immune cells. T lymphocytes, B lymphocytes, neutrophils, macrophages, dendritic cells. These are some of the common ones. So I went through the literature and tried to find papers where they measure glucose utilization when these different cell types are activated. And in almost every paper I could find, I don't think there was ever one that showed no change or a decrease in glucose when you activate these cells. So the average percent change in a T lymphocyte is over 2,000%. In a dendritic cell, 71% increase. Those are the percent range changes that you could find in each of those cells and papers and references. But when that's all in vitro or ex vivo. When you actually start to look at tissues in vivo and think about more systematic biology instead of in a petri dish, there are some tissues that have an increase in glucose utilization when the immune system's activated, and there are some tissues that don't. And if you think about it, it makes sense that the lung and the liver, which are really immune-rich tissues, they would have an increase, and a pretty big increase, in glucose utilization when the immune system's activated. Whereas things like the brain or reproductive organs, they would have less or no response when the immune system's activated, because your body is prioritizing those tissues that are going to help you fight the infection, and they're deprioritizing the tissues that you don't need right now, that are just going to be more of a drain, and make sure that you stay alive so that you can continue to reproduce. So just a fun little table of all of these different references that measure glucose utilization in tissues and immune cells. So like I said, when activated, immune cells demand a large amount of glucose. But the challenge becomes it's really hard to quantify glucose demand or glucose requirements of an activated immune system, because the immune system is in all of your tissues. You have immune cells in your finger, you have immune cells in your brain, you have immune cells in your knee. It's everywhere. So where we as nutritionists think about catheterizing the vein and the artery coming out of a liver to measure flow in and flow out, it's really hard to do that with the immune system. But what we noticed when we started looking at immune activation was that sick animals become hypoglycemic. So I remember Saturday Project, we were doing an LPS challenge in pigs, and I gave the LPS to a pig. It became very hypoglycemic to the point where the blood glucose meter would not read the glucose level of the blood of the pig. And so I had to give that pig a couple syringes of glucose to get glucose levels back up. And that kind of sparked the thought of, well, what if we clamped their hypoglycemia so that it's euglycemic? And in that way, use it as kind of a proxy of how much glucose the immune system's using. So to graphically represent that, we gave an LPS bolus. You see actually a period of hyperglycemia for about 180 minutes, and it's shockingly consistent across animals and even species. You see this hyperglycemia, and then they crash and become hypoglycemic. And that goes on for quite a while after the LPS challenge. They will eventually come back, but it is quite a while before they do. And so if we infuse glucose to maintain euglycemia during this hypoglycemic period, can we use that as a proxy of what the immune system is using when activated? And so those are the questions that we started asking going into these research trials. What are the energetic implications of immune system activation? So I'll get into detail more about the lactating cow trial because that's generated the most interest when thinking about inflammation and all the times cows are inflamed potentially on a farm. We used 18 lactating Holstein cows. They were about 170 days in milk, and we gave them one of three treatments. Either they got 3 mils of sterile saline or they got LPS at 1.5 micrograms per kilo body weight. In one of the LPS treatments, we just let them develop hypoglycemia. In the other LPS treatment, we clamped them at their euglycemic levels using 50% dextrose and a hospital infusion pump. So we took away feed, we milked them, we took baseline blood samples, we gave LPS, and then followed them over a 12-hour period. During that 12-hour period, we did milk them twice. So these animals were being milked frequently so that we could characterize the decrease in milk and account for that reduction in glucose going to milk as well. Here's some pictures of this study. So cows were bilaterally jugular catheterized. So she's got a jugular IV on both sides. One is attached to this hospital pump. The other one is where we take our frequent blood samples. So we were sampling every 5 minutes to check her blood glucose levels. And we did that with one of those glucometers that a diabetic might use to monitor blood glucose levels. And then we would adjust the IV infusion accordingly so that she could maintain euglycemia. So here's what blood glucose looked like. So this dashed line represents the cut off between the hyperglycemic period and the hypoglycemic period. So this is our control animals. Blood glucose stayed pretty level throughout the whole day. This red line represents our LPS animals. So when we gave LPS, we get that period of hyperglycemia. Again, at about 180 minutes, they crash. So this line separates before 180 minutes was their hyperglycemic period. Afterwards was hypoglycemia. So they crash, they come back up, but they are statistically hypoglycemic compared to the control. So the blue line represents those animals that we were infusing glucose to maintain euglycemia. So during this period, we are not infusing because of that hyperglycemia. But once they do become hypoglycemic, we start infusing and we maintain them at their baseline levels. So you can see right here, they crash really quickly, and it's hard to get ahead of this crash. So there are actually 2 time points here where we are below normal blood glucose levels, but we did get them back up and clamped fairly quickly. So looking at milk yield, these cows were producing about 40 kilos a day. They were being milked 4 times a day. And once we infused LPS, there was an 85% decrease in that milk yield 360 minutes into the trial, and then 720 minutes into the trial, they're still about 85% less than the control. What's interesting to me here is the control dropped from 10, probably about 11, down to 9, down to 7. So just not milking for 12 hours really decreases your milk yield as well. Something maybe I was expecting them to maintain their yield at each milking a little bit better, but they did drop down quite a bit just from not eating food. So we did pull food from these animals for 12 hours. Regardless, even though we were infusing glucose, it did not bring milk yield back. So that glucose that we were infusing was not going into milk. So when we do the math and we subtract, the glucose that was normally going into milk plus the glucose that we were infusing, what we find is that a little over a kilo of glucose in a 12-hour period was used for immune system activation. That's a pretty big amount. If we can extrapolate that out to 24 hours, that's almost 5 pounds. 8.7 megacals per day when you think about 4 cals per gram of glucose. If you extrapolate that back out to milk, that's about 65 pounds of milk per day, because if you think about 72 grams of glucose equals 1 kilo of milk. So just a little bit of math to put it into perspective of how much energy that really is. It's a pretty big amount. And to be fair, this is a really intense immune activation. So a cow might not typically experience a huge immune activation all at once. I would argue maybe really toxic types of mastitis might be similar to what we showed here. But in general, an immune response is going to be a little bit more gradual than what we were doing here. But, this is a research setting. We had to do things where we knew when the immune challenge was starting. We needed it to be a big immune challenge so that we could measure things. And again, thinking about toxic mastitis, it's really not out of the realm of what a cow might experience. So big picture, in a normal, healthy, lactating animal, there is a big part of that feed energy going toward milk, reproduction, regrowing body tissue, and a really small portion going towards maintaining the immune system as long as she's healthy. And when you do have immune activation, that energy gets redirected away from milk production and reproduction and growing body condition back and towards the immune system. And if the immune challenge is so bad that she goes off feed, she actually becomes catabolic. She'll break down muscle tissue. She'll shut off milk production so that her immune system can activate and help her survive the challenge. So how practical is this for animals that we see in production today? When you think about the transition period, there's a lot going on. Starting from 60 days prior to calving all the way through 21 days after calving, there's a lot of changes that cow experiences. There's a lot of things that could result in inflammation. So here, the blue line is representing maybe what we would call healthy inflammation. Because we can't prevent these things, the act of parturition is going to cause inflammation no matter what. You need a healthy response that resolves the inflammation and then goes away. But the more we kind of stack those stressors, I think the bigger challenge she has in overcoming that inflammation. So for example, at dry off, she might experience a pen change, a diet change. She's experiencing mammary involution, mammary distension. You do some vaccinations at that time. Those are all unavoidable. These are things that happen on every farm, right? But if we add more stresses to that, so like if we don't do a good job of drying her off and she has residual mammary infection, or we're overcrowding her, that can add to the inflammatory load. Maybe somewhere in the dry off period, she has an out of feed event. She experiences another bout of inflammation. Maybe when she starts to move into the close-up pen, not only does she have another diet change, another vaccination potentially, a pen change, but maybe there's a mycotoxin challenge in that diet that she's got to now deal with too. And when she starts lactogenesis, that could potentially be a growth media for dormant bacteria in the teat canal. And maybe she'll experience another pen change, and that's going to add to the inflammation. And then, of course, calving is a very inflammatory event. Another pen change, another diet change, uterine involution, these are all pretty normal things, but maybe she has dystocia. Maybe the feeder is not delivering feed on time, and she's got that stress added to her, and the social stress of another pen move. There's lots of things that can contribute extra, added, unnecessary stress during the transition period that can add to this inflammatory load. So not only lactating cattle are affected by immune challenges, but when we think about young stock, they can be just as susceptible. Think about BRD or other infectious diseases that these guys experience when they start commingling. So we did this exact same experimental setup, the clamp, the euglycemic clamp, the LPS challenge, everything was identical, but we did it on a 300-pound Holstein steer. And we used about 500 grams of glucose in an activated immune system in 12 hours. So if you extrapolate that out to 24 hours, that's about a kilo. A kilo of glucose is worth about 4 megacals per day. And when we think about the goal of young stock is to grow them quickly and put on lean tissue quickly, protein synthesis requires about 10 kcals per gram of protein synthesized. On a lean tissue basis, so we're adding back the water, that's about a kilo of lean tissue per 4.1 megacals. So in 24 hours, the activated immune system could use that energy, the same amount of energy that it takes to synthesize almost 3 pounds of lean tissue. So it's not going towards the productive growth, it's going towards the immune system, something we want to avoid if we're going to grow them quickly. And it shouldn't be a surprise to anyone, right, that a healthy animal grows quicker because they have the energy to do so. Same situation with pigs. So we did the same euglycemic LPS challenge in pigs. These were about 67-pound pigs, and we used about 116 grams of glucose in 12 hours. So about 232 grams in 24 hours. That's almost a megacal per day. Again, going back and looking at 10 kcals per gram of protein are required. In 24 hours, the activated immune system could require the same amount of energy that it takes to synthesize almost 0.7 pounds of lean tissue in a growing pig. What's really fascinating to me is that when you compare these LPS euglycemic clamps across species and put it on a metabolic body weight basis, it's shockingly pretty consistent and similar between species and between physiological states. So in a cow, they're using almost 0.7 grams of glucose per kilo metabolic body weight per hour. In a steer and a pig, it's about 1 gram of glucose per kilo metabolic body weight per hour. So the fact that it's right about 1 across these different species, across these different ages of species, really tells me that this is a conserved response in the immune system. That it's a huge energy drain, and it's always about 1 gram of glucose per kilo metabolic body weight per hour. So what can we do about it? We know it's a huge drain. We know it's a problem. We don't want energy going towards inflammation when it could be going towards growth. It could be going towards milk. So the obvious answer here is to prevent inflammation. Keep a clean environment. Minimize the stresses, because anytime we have stress, that is an opportunity for inflammation through gut health and compromising the gut integrity. So this involves things like feed restriction, when you wean, when you're shipping animals, overcrowding, unpalatable feed, mycotoxins, things that would cause inflammation, prevent them as much as you can. That is really on the shoulders of the dairy producer, right? You do the little things and they add up because the little things keep inflammation from happening. Kind of the joint responsibility between the nutritionist and the producer is to prevent rumen acidosis, prevent things that are going to cause gut issues, maximize digestion prior to the large intestine, so that there isn't that hindgut acidosis, hindgut protein fermentation that can really mess with things in the gut. And the gut is a big source of inflammation. The nutritionist's responsibility in all this is to look at feed additives that have a positive effect on gut health and to explore feed additives that have kind of immunomodulatory strategies. What is the data behind them, looking at how they impact inflammation and how they impact stressful times in a lactating cow or growing animal. There are some interesting immunomodulatory strategies out there, and we're still learning a ton. So I think it's important that they're tested in a stress environment. A lot of times you might feed an additive when there's no stress and it doesn't do anything. But when the animal is stressed, there's a really positive impact. And so just keep in mind that the condition that the animal is in and the stress that that animal has to overcome is really the true test of whether a feed additive is going to help that animal or not. So the big take home from this is that inflammation costs energy, and energy is something we want going towards productive purposes. And in a transition cow, there's always going to be a little bit of inflammation because of calving. It's just a process that creates inflammation. But what we don't want are additional stressors on top of what she's already got to work through. So inflammation can be caused by a variety of things, psychological things like feed restriction or not delivering feed on time. It could be feed hygiene, having mycotoxins or other issues with the feed. It could be pen moves. Too many pen moves, too much social change will stress her out and cause inflammation as well. There's a whole host of things that could be listed here that are under the farm's control, right? So the more that you can keep her clean and happy and healthy, the better she's going to be able to transition. An acutely activated immune system uses over a kilo of glucose, and we don't want that going to non-productive purposes. We want to get her over the hump and into lactation as quickly and as efficiently as possible. So preventing inflammation is going to save you money. It's going to keep her healthy and productive throughout her lactation. Thank you for your attention. I appreciate you watching this video. If you have any questions, please feel free to reach out. My contact information is here. Again, thank you and have a great day.